Transition Tuesday. I'm Jane. This is Joe. Today, Transition Tuesday is the name of this show, and it's because transitions are very important things in people's lives, whether you have a disability or not. And the reality is, things are changing all the time. Transitions are happening all the time. Sometimes they're obvious and sometimes they're subtle. So we're calling today's episode, What Changed? We recently had some experiences with Joe that taught me some things about cerebral palsy in young adults that I wasn't really aware of. Oh, thank you. Joe's an awesome teacher, and he just is who he is. So what I want to say is behavior is communication. You've heard me say this before, but in nonverbal people, behavior is the way they tell you about things that may be changing inside them, like levels of pain, or anxiety, or maybe just not feeling well, or maybe being really happy. Behavior is communication. So you watch a person's behavior to identify what's going on with them. So neurological issues impact a person's ability to communicate and their ability to regulate their emotions. So they may have extreme reactions to things like frustration, fear, pain, that you or I would not react in the same way, but because of the neurological pathways being damaged in a person's brain, they are not able to react or regulate their emotions. So how do you identify the signs of trouble in a person who's nonverbal? Joe, we're going to ask you some questions in a little bit, but we're going to talk about this first. So watch him. We're going to talk about some of these things. Signs of trouble. Problems sleeping. This is hard on the caregiver. Joe has been having some problems with sleeping lately, and we were trying to figure out what was going on with him. Just not sleeping. I started charting it to try to see if there was a cause and effect that I could identify over the last couple of weeks, and I was not able to, but I'm going to tell you this story in little pieces. For people with CP or other neuromuscular issues, seeing an increase in tremors, spasms, in infants it could be increased startle, sometimes can indicate that the person is experiencing some kind of unease, pain, anger, frustration, not feeling well. Some of these can be quite significant. Self-harm or violence. On cue, Joe, awesome. Teeth grinding. Especially if you notice that your child never did that and now they are doing it. Spitting or drooling. Refusal, I really should have put avoidance on this. If a child doesn't want to do something that they used to like doing, riding in the car, going to school, going to church, watching a movie that they like, listening to a song that they like. If suddenly they're avoiding that, that might be a behavior which is communicating something else. Stress brought on by anxiety or fear. Stress, just stress. Seeing that the person seems stressed out. Crying. When Joe was an infant, he cried all the time, constantly. We never could figure out. Sometimes putting him in the bath would help him, taking him outside, but he cried a lot. And then laughing. Our daughter calls it stress laughter, like when you tickle someone and they laugh. They don't think it's funny, but that's the neurological response to the stimulus. So Joe, can I ask you some questions? So this is stress. Joe's stressed, trying to get his neuromuscular response together. It's a reaction to stress. Joe, does it hurt to be a person with CP? Do you feel pain a lot of times? Are you in pain a lot? Yes or no? Serious question, I know. And I know it's a personal question. We did talk about this ahead of time, and he was okay with me asking this. Joe, does having CP hurt? Yes or no? Does it hurt sometimes? Do your muscles hurt sometimes? Your body hurts sometimes? So it looks like he's just having the time of his life, but his neural ability to respond to a question sometimes gives you the opposite of what you're expecting. Asking somebody if they're in pain would elicit kind of a shyness or a withdrawal. In Joe's case, he's smiling. You didn't answer my question. Does it hurt to have CP? Do your muscles hurt sometimes? Yes or no? Can you tell people if it hurts sometimes? Tell me with your voice. Yeah. See, it does hurt sometimes. Is it hard for you to tell me when you're hurting? Yes. Is it hard for you to tell people when you're hurting? Yes. Touch my hand if it's hard for you to tell people when you hurt. Yes. This is what I'm saying. It's hard, and sometimes Joe had an incident this week. His body went into full tremor from head to toe, and we didn't know what was going on. He was spitting. He hadn't been sleeping. We ended up going to the hospital. We needed to adjust his medications and just let the doctors figure out what was going on with him. There's no definitive answer, which is the trouble with CP and autism and Down syndrome. There's not always a definitive, this is the cause. So you just kind of have to figure out by a process of elimination and trial and error. And so we did change and revise some of his medications. We think maybe he was having some GI distress, and that was causing some of the exacerbation in his spasms and things. But we don't know 100%. Nonverbal people are a mystery wrapped in an enigma sometimes. But here's what you do with going down the list to see what this behavior is trying to communicate to you. Reasons for stress. Kids who have disabilities in school settings and out in the world are often bullied. Bullying can bring on some changes to a person, just like pain does. Emotional pain, physical pain, same thing. Your body reacts that way. Inability to express oneself. Can't tell mom about bullying. Can't tell about somebody who was mean to me. Can't tell about a caregiver who treated me badly. Can't tell about my stomach hurts. Frustration. And as I said, pain. Your reaction to emotional or physical pain. So what do? What can you do? You're the caregiver. You can't just ignore it. The person is asking you for help. What are you going to do? Maybe you're not the caregiver. Maybe you're not the parent. Maybe you're the caregiver. What can you do? Well, identify potential sources of what might be bothering the person. So you know that list I gave you. Are they frustrated? Are they in pain? Is someone being mean to them? Are they sick? Now, if you're a caregiver and not the parent, you can't enlist professional help, but you go to somebody. Look for some help. In our case, we went to the hospital. We tried to figure out, let's eliminate potential things that could be going on, and then let's see. Medication is not my favorite thing, y'all, but it's necessary to deal with his pain, his spasticity. People with CP get constipated a lot, and that can make you very uncomfortable. And then help the person deal with what they're going through. Approach the situation in a positive way. We kind of included Joe in the decision as to whether or not we would go to the hospital. The EMTs came. We asked Joe if he was feeling okay, and when he started feeling better, he told us, and then we kind of talked to him about what we needed to do, and Joe was part of the discussion. Although he didn't get to pick the hospital. That was a mom job. Help the person process their emotions. I see that you are upset. Can you help me understand what's going on? Ask yes or no questions. Simple questions. Be patient. Give the person an opportunity to answer, and while they're doing that, observe. Drooling, laughing, crying, spitting, tension, violent behaviors, all those things we talked about. Find a mantra or a calming image. I know it sounds kind of goofy, and if this isn't your thing, I understand, but it's kind of like distraction. With Joe, we practice breathing. We practice breathing in and out, calm breathing in and out. We actually call it Thor's breath, and we have this whole image of Thor in Asgard, and he's looking down on Joe, and he takes a deep, mighty Thor's breath in, and then when he breathes out, the thunder comes, and but this is what works for Joe. For someone else, the mantra might be, I will be okay. Just practice and find something that the person likes and connect it to that. Practice the scenario with the mantra. When you're not in a stressful situation, that's when you practice. Okay, so Joe, the next time you really hurt, let's practice your Thor's breath. In and out. We used to practice it at the bus stop on Thursday, which is named after Thor, by the way. We used to practice it every morning, but we don't go to the bus stop anymore, so we kind of got out of practice. Build on the experience step by step. So maybe the next time you think the person might be experiencing some pain or discomfort or anxiety, remind them about the image or the mantra or the tool you're using. And then, if you practice it enough, you can step into the real world. And it may not work every time. Don't give up, though. Keep trying. You know, being a nonverbal person in a verbal world is not easy. And folks like Joe need your support, your patience, your interest, your willingness to learn, and we'll all be the better for it. So thanks for joining us again. Joe's happy you came. See you next time.